Close your eyes for just a second and picture a hospital. Honestly, chances are you're imagining glaring fluorescent lights, those long sterile hallways, the constant beeping of machines, and just an undeniable feeling of anxiety, right? For decades, we've kind of just accepted that this stressful healthcare environment is a necessary backdrop for getting medical care. But what if we've had it completely backwards this whole time? What if the walls, the lighting, the actual layout of a medical facility shouldn't just be a passive container for doctors and patients, but an active integral tool in your recovery? Can the design of a building actually help you heal? Well, allow me to introduce to you our study, Pili Camarines Sur Evidence-Based Design Hospital. And we are Kyla Isabel L. Alarcon and Yuan B. Amaranto, the proponents of this study. We'll look at how physical environments directly impact patient outcomes. We're talking about reducing recovery times, lowering infection rates, and even supporting the mental health of the family, doctors, nurses, and staff who are out there saving lives. To really understand the power of these solutions, we have to look at the reality on the ground. Pili is what's called a first-class municipality, which basically means it's this massive hub of economic activity and rapid growth. But 8 out of 26 barangays or neighborhoods in Pili are currently identified as completely underserved when it comes to medical access. Okay, let's dive into this number because this is where the reality gets incredibly stark. As of 2024, the population of Pili is over 101,000 people. Yet to serve this massive and rapidly growing community, they currently have to rely on just 2 government-owned rural health clinics. And it gets more alarming. Each of those clinics only has 1 licensed physician. Pili is operating so far below that standard that residents literally have to travel to neighboring cities just to get basic urgent care. This isn't just an inconvenience, It's a full-blown crisis that costs time, money, and tragically, lives. So we don't just need a bigger building. We need a significantly smarter one. This study aims to achieve the following objectives. First is to identify the current state of healthcare facilities and services in Pili, Camarines Sur. Second is to determine the spaces needed for the hospital in Pili, Camarines Sur. And lastly, integrate evidence-based design or EBD features for a hospital that support patients, families, physicians, nurses, and staff. And this brilliantly illustrates exactly how researchers structure that intervention. It's kind of like a giant puzzle. On the left, we've got the input process output model. This maps out how they gather data on the current state of healthcare, process it through the lens of evidence-based design, and output a tangible physical hospital plan. Then on the right, look at the theoretical framework. Notice how it takes the built environment and breaks it down into highly specific variables. Things like the audio environment, the visual environment, safety enhancements, etc. The researchers methodically link each of these physical variables directly to real-world outcomes for patients, families, and staff. With the conceptual and theoretical frameworks serving as the foundation of the study, we now present the results and discussion. In an interview with the 2 RHU physicians of Pili, both expressed their concern about healthcare delivery due to the unequal and limited distribution of healthcare facilities, which also indicate insufficiency in healthcare services. This is also evident from the online survey results, highlighting that if the healthcare facilities are poor, delivery of healthcare services becomes ineffective. In compliance with the standards imposed by the government, the researchers followed necessary documents from the Department of Health regarding the required spaces for a Level 2 hospital. Moving on, here are the 4 themes of evidence-based design. First is the IEQ, or the Indoor Environmental Quality. IEQ emerged as a top priority. 87% of respondents rated cleanliness and odor control as very important, while 83% emphasized the need for good ventilation and fresh air to ensure a safe and comfortable stay. Second is the design and layout. Regarding the physical layout, the community prioritized efficiency and space. 75% of those surveyed identified adequate space in corridors and rooms as a primary necessity. Furthermore, 70% highlighted that a clear wayfinding system is essential to reduce the stress of navigating a complex hospital environment. Third is the socio-cultural considerations. A hospital must serve everyone. Our results show a strong demand for inclusivity, with 82% of respondents rating child-friendly and elder-friendly environments as highly important. Additionally, 72% emphasized that the design must strictly respect patient privacy and dignity. And lastly, the functional performance and safety. This theme received the highest importance ratings overall. A staggering 89% of users demanded easy access to emergency and critical care services. Safety is also paramount, with 81% requiring specialized features like non-slip floors and handrails for persons with disabilities. So armed with all this incredible data, researchers can actually start to conceptualize a hospital. The healing power of architecture translating data into design. Notice the really beautiful slatted wood walls. It isn't just about looking modern and sleek. The research shows that loud noise in a hospital causes massive spikes in patient stress. They disrupt sleep and gases. They can even lower oxygen saturation in infants. So, by integrating acoustic panels and natural wood aesthetics, and this directly reduces patients' anxiety. So, the crucial point is that form must absolutely follow medical function. Look at this rendering of the patient bathroom. We know from the data that patient falls, especially at night, just trying to get from the bed to the toilet, are a massive hazard. We also know that hospital-acquired infections are a critical threat. Well, this design tackles both of those issues head-on. The floors use very specific non-slip materials. There are strategically placed handrails to ensure stability at all times. Let's zoom out a bit into the wider spaces and see how this builds a supportive ecosystem for literally everyone inside. Evidence-based design completely recognizes that the hospital simply cannot function if its staff is entirely burned out. Now you see this gorgeous open atrium filled with natural light, plants, and water features. Studies consistently prove that clear nature views drastically decrease stress for everyone who has to spend long, grueling hours inside a building. And then, we see carefully designed, highly ergonomic physician support spaces. Proper lighting and well-organized consultation rooms enhance communication and reduce the physical strain and the resulting medical errors that tend to happen when doctors are forced to work in poorly designed, cramped little environments. A true healing environment has to harmonize with the world around it too. The proposed hospital in Pili actually sits in a pretty flood-prone area, which, as you can imagine, poses a massive risk to a critical care facility. But the researchers didn't just suggest building a giant concrete wall. Instead, engineered brilliant ecological solution. There will be a detention pond that temporarily stores and slowly releases storm water, completely mitigating local flooding. It will add in a rainwater harvesting system, solar panels to offset energy costs and ensure resilience, green roofs and bioswales to reduce the urban heat island effect, and permeable concrete. This building doesn't just sit on the environment, it actively works in partnership with it. All of this brings us to a really profound realization about the future of our infrastructure. The environment itself should be a healing space. It's about recognizing that architecture is a vital, active participant in the entire healing process. By leveraging evidence-based design, we can create spaces that protect our most vulnerable, empower our hardworking medical professionals, and deeply respect the natural world, which leaves us with something incredibly important to think about today. We spend a vast majority of our lives inside the buildings, whether it's our homes, our offices, or inevitably our hospitals. If we now have the data to prove that the walls around us can literally heal us, significantly reduce our stress, and keep us safe, how should we be building our future? Once again, this is our study entitled Pili Camarines Sur Evidence-Based Design Hospital. Thank you.